Good morning, everyone, and thanks for joining our webinar today. My name is Sydney Powell, and I'm in the marketing department here at Revell. I'll be the organizer of today's webinar, and we're really excited to have you on the line. We have some really great information lined up on all things annual wellness visits, but before we get started, just a few reminders. I am recording this webinar and I will make the recording and slides available after the webinar. I'll send you an email that has the recording and the slides, and you'll be able to have that at your fingertips later this afternoon. And also at the end of this webinar, we do have a question portion where you will be able to type any questions that you have, and we can do a live question and answer portion. So moving on, I'd like to introduce you to your presenters today. Up first, we have Marie Moss, who is one of our coding auditors. Following her, we have Therese Molinaire, who is a certified eClinicalWorks trainer and implementation specialist. And then after Therese, we have Tiffany Richardson, who is also a certified eClinicalWorks trainer and implementation specialist. So our amazing presenters have some fantastic information on docket for today's webinar. I can't wait for you to hear what they have to say. But first, I'm sure there's some people on the webinar that might wonder who we are, what we do, and why we're presenting on this topic. So to explain Revell a little bit, we are one of the few end-to-end revenue cycle solutions built for eClinicalWorks users who want an integrated, data-driven, and dependable service. Unlike other RCM solutions that leave your in-house staff following up on claims and answering patient phone calls, Revell offers expertise, scalability, and efficiency healthcare leaders need to build a richer revenue cycle in a rapidly shifting healthcare environment. We take a team approach to our success. Revenue cycle management automation is meant to support our solutions, not replace it. We assign our clients a client success team led by US performance managers, and these team members come with years of experience dealing with RCM challenges and are here to help serve the day-to-day needs of our customers. You can also expect to work with a billing consultant, coding consultant, team leads, an eClinicalWorks certified trainer, among other team members supporting the RCM process, which also includes certified coders and patient service representatives. As a revenue cycle management service, our goal is really to be a partner with our clients. We know that staying up to date with everything in the Medicare and medical billing field can be challenging, but we care about your success and want to share our knowledge and expertise on everything, including our topic for today's webinar, annual wellness visit specifications. If you have any questions about how we help our clients keep up with the industry changes and increase their cash flow, we'd love the opportunity to connect with you. But we're really thankful that Marie, Therese, and Tiffany could join us today. They've really put some great content out there, and I think you'll find it very helpful if you're looking for ways to stay informed and updated on the details surrounding annual wellness visits. So let's take a quick glance at our agenda. So we're going to be covering Medicare preventive services, coding and guidelines, national coverage determination, financial liability, telehealth, CDSS alerts, questionnaires, and add-ons. So again, a great agenda. We're really excited to have you join us today, but enough from me. I'm actually going to hand it over to Marie. So what you've all actually been waiting for. Take it over, Marie.
Thank you, Sydney, and thank you everyone for joining us today. And I hope you find all this information very, very useful. So with that, Medicare covers many preventive services for the most part at no cost to your patients. We highly recommend you to encourage your patients to take advantage of appropriate preventive services to prevent and find diseases early. Engage your patients in effective health management by providing a personalized care model of tools and processes easy for them to follow and to adapt to. In each of these services, you'll find coverage, coding, and billing information, facts, and resources. Within the resources, you'll find the CMS Preventive Services webpage that will direct you to more beneficial information such as current season flu shot payment rates, provider resources webpage, the latest announcements, preventive services checklist, There are a total of 30 preventive services. So for this preventive service checklist, this is a double-sided card listing all the preventive services. The blank lines could be utilized for the date the service was rendered, as well as the provider's name who provided the service. This card is a wonderful reminder aid for the patient and a great marketing tool for your practice. Remember, friends share where they have received good and caring service. Each preventive service has multiple sections. What's changed? National coverage determination, HCPCS, CPT codes and guidelines, prolonged preventive services, ICD-10-CM diagnosis codes, coverage requirements, frequency requirements, patient liability, telehealth eligibility, modifier usage, seasonal pricing, billing hospice, documentation guidance, visit schedule, and social history and that schedule. So a couple of examples would be here within the preventive services, such as lung cancer screening. Here you'll find what's changed, the ICD-10 information of codes to use, and any modifier usage. In the screening mammography section, you'll find, once again, what's changed, ICD-10 information, and modifier usage as well. Another example is in the flu shot administration. Scrolling down through all the codes, you'll discover that Medicare hospice providers may bill flu shot services on institutional claims. Moving back up to the top is the seasonal influenza vaccine pricing. By clicking on that, we'll provide you the list of codes for the particular 2021 or the current flu season year, all the CPT codes, the labeler or the pharmaceutical companies, the name of the vaccine, payment allowance, and their effective dates. For the social history and schedule, you can find that in the counseling to prevent tobacco use. As you can see here, for the social history, as we all know, tobacco use falls underneath that. So it has the information in regards to that. And the schedule, such as 2 cessation attempts per year. Each attempt may include a maximum of 4 intermediate or intensive sessions, with the total annual patient getting up to 8 sessions per year. So for the what's changed, as you can see here, the little kind of like Band-Aid looking emblem that you will find in the preventive services, you will find information such as what years they are referring to here, 2021, which quarters, right here is the second quarter. Also any new and deleted code information. Another section to the preventive services is the national coverage determinations. Not all preventive service has this, but most of them do. Also, it provides additional information, including the coverage and non-coverage, reason for the risk, age requirements. Also, at a minimum level, staff assisted supports consist of clinical staff, gives you a great identification of which type of staff they're speaking of, nurse, physician assistant, what type of settings. This would be a primary care setting. And this is who can advise the efficient of screening results and who can facilitate and coordinate referrals to mental health treatment. So with that, a great example is with the preventive service, going back to the screening mammography. Okay, it says billing a screening mammogram or diagnostic mammogram on the same day, use modifier GC. So it just provides additional information for that. Also with the national coverage, as you can see here, determination, it'll be a little bit more specific with the frequency, and notice there's age involved with it too, and also speaks of the different of the risk, whether a patient, whether it be from a family member, of a mother or sister or something. So with that risk. Another section to the preventive service is the codes, the CPT, the HCPCS, the Category 3 codes. And usually this, the ranges for the CPT are in the 80,000 through the 90,000 codes. Also Medicare G codes are involved. And then with the Category 3 codes, which are designated as temporary codes by American Medical Association. And even though these codes are considered temporary, they are an integral and important part of the system. The American Medical Association guidelines for Category 3 codes include the following statement. Category 3 codes allow data collection for emerging technologies, services, procedures, and service paradigms. Using unlisted codes does not offer the opportunity for the collection of specified data. So the American Medical Association has a statement within here is if a Category 3 code is available, this code must be reported instead of a Category 1 unlisted code. Also with these codes, in addition to this code section is other notes where it will provide additional coding guidelines. For the patient liability section, it gives you the information of applied or waived co-payments, co-insurance, and Medicare Part B deductibles. The one thing that, or a tip that we have is for those previously diagnosed patients. As we spoke in the annual wellness preventive services, that with patients of this age may not remember what was performed, what was done during their annual wellness visits. So for the most part, most people are aware and practicing healthier lifestyle, as long as it doesn't become cost effective to them. So most of the preventive services, the co-payment, co-insurance, and Medicare Part B deductibles have been waived. However, there are some which have applicable co-pays, co-insurance, and Medicare Part B deductibles. So getting your patients to undergo some of these preventive services, this may be a hard sell, even if the patient is at risk or has hereditary influence. So you're going to have to prove to them that, the reason that they, should have the services. But please always be up, front with them that there might be an applied co-payment or co-insurance or Medicare Part B deductible. For the most part, that they are being waived. Patients who have been previously diagnosed by another provider may be liable for co-payments, co-insurance, or deductibles. And it could be like an example, a patient has already been diagnosed with diabetes and not relaying that information to you, and you decide due to the patient has just informed you a family member has been diagnosed with diabetes and you want to do a screening. You have to remember their cognitive condition, so something to take in consideration. within the preventive service, especially today, as we are still involved in this pandemic, we're all interested in doing telehealth services. We found out that it's really an easy, much easier to do than that was anticipated. So with that, I just wanted to show you that when you select the service, you're going to see this emblem peppered throughout these different services. And these are for telehealth services. And with that, I owe an apology to those who had joined us for the IPPE and the annual wellness visits, because I did make an incorrect statement, which I cannot apologize enough for, that I said that the annual wellness visit was not a telehealth services. Well, you can see it is. All right. It is during the pandemic. It may change because it doesn't show up on the appendices P and the CPT, or with the American Medical Association. So it might be something that we really have to watch, for the date where it'll no longer be available to us. So definitely something to keep in mind of. So always pay attention that that we have many of these. All right. So some of the services have it, some of it doesn't. And one of the things that I just wanted to expel upon is that you're you probably have already found out that you're collecting more information about your patient's care through telehealth. And this is because some of the sensitive topics that patients really don't want to talk about, if they're suffering from alcoholism or drug abuse or something like that, is kind of embarrassing. They don't want to see your face of disapproval. So, but when you put them behind a screen, like a computer screen, and they're elaborating, they will actually go above and beyond, maybe probably give you more information than you really need, but that way it gives you a much more clear understanding. So there's a lot of goodness to the telehealth services. And what's more, still keeps us COVID safe. We're not out of the pandemic, and we still need to be practicing good COVID measures with that. All right. Including coverage requirements, there is a lot of things to take in consideration is underlying conditions, low or high risk, asymptomatic, hereditary, gender, ethnicity, and age. And some of the examples for that could be such as with the colorectal cancer screening. Definitely gives information on age related and asymptomatic. Okay, so it's right there with that. And then for underlying conditions, hereditary, you can find that in the glaucoma screening. Okay, so underlying condition would be a patient with diabetes, or a patient who has a family history of glaucoma. Also speaks of ethnicity, both African Americans and Hispanic Americans, and is age related. So stuff you really want to watch out for. And for the modifier usage, as we've been discussing that these are all preventive services, and some are going to require, and it is within the requirements, is the modifiers, such as modifier 33, which is for preventive service. And it's to be appended to identify the service is specifically preventive services. So I know that it's kind of like an oxymoron, that if it is, right? But you have to think about, such as an example, it's a colorectal cancer screening. That can be performed for patients who are of age, and it can also be performed as preventive services. So you just really have to understand the situation. Another modifier is GG, which is performance and payment of a screening mammogram and a diagnostic mammogram that is done on the same patient on the same day. And it basically is to show that the screening mammography turned into a diagnostic mammography. Sorry for that. Okay, next is modifier PT, which is for the colorectal cancer screening test and just like the mammography, it is converted to a diagnostic to other procedures. And Medicare will waive the deductible with that modifier PT. And the last one is modifier TS, which is for a follow-up service. And this could be an example of a patient submitting a patient's diabetes claim, pre-diabetes claims. Probably that the patient has a family history of it and maybe starting to, to show some possible signs. And so that you will want to continue to follow this patient and helping them. And as I know that they say per national statistics that patients over 65 years of age, so that makes them Medicare, over half of them are in pre-diabetes stage. So something to think about when you're seeing your patients. Okay, a couple of terminology things that I wanted to go over, and that is with screening. For the most part, most of us believe that screening is a service for when the patient has no symptoms. And that is true, and it is not true. In medicine, it is a strategy used to look at an unrecognized condition or risk markers. And with the risk markers could be with the alcohol screening, okay? That you need to screen the patient who do abuse and misuse the amount of alcohol, or that they receive abuse by a family member who is, suffers from alcoholism. So it's not just a service that the patient doesn't have symptoms, but they are in a condition to where they receive abuse or the misuse of it. For the counseling, this is the provisions of assistance and guidance in resolving personal, social, or psychological problems and difficulties, especially provided by a professional. All right, so I'd like to go over some of the tips that we have for the ICD-10 codes, okay? So please pay attention to, like I said, that kind of bandage looking thing. For what's changed, pay attention to the new and the deleted codes and also those effective dates. Code specified codes versus unspecified codes. I'm seeing a lot of denied claims because they feel like we could be a lot more specific. And just like they were talking about or if you look into the mammography screening, they even talk about coding it out to the maximum of the quadrants of the breast. So be a little bit more specific with that. Code anatomical sites too. Okay, so kind of goes along with the specified codes and the anatomical sites of the breast quadrants. Check the NDCs for any change request. Review the note for additional specific ICD-10 codes, as well as that, I talked about the CPT, but also you'll find ICD-10 coding guidelines in there. And as always, we highly recommend that you contact your MAC for any guidelines as it pertains to any of the things that we've been educating you with. And with that, that's all I have for today. So at this time, I would like to hand it over to Therese.
Thank you very much, Marie. I just want to confirm that you can see my screen.
Yes.
All right, perfect. So as Marie said, she's talking about a lot of the preventive information that can be captured for our patients that with the IPPE or the annual wellness visit. And so what I'm going to expand upon today is CDSS alerts, how to see them, configure them, and how to use them and satisfy those alerts in a patient's chart. So I'm going to start and go to menu, and then EMR, and then I'm going to go to CDSS. Once I click on CDSS, I'm going to go to configuration. So within this configuration window, do you see these tabs here, enable, disable? So CDSS alerts is clinical decision support systems, right? These alerts are set up and designed, right, to satisfy your quality measures. While it doesn't have all of the quality measures, it does have some very important ones. And if you scroll down through this entire list, right, their CDSS alerts are based on age, sex, and diagnoses. Okay, so you can scroll down. There's many of them in this list, as Marie was talking about, your colorectal, the breast cancer, the flu, the pneumococcal. There's all different ones. I would recommend you do enable. Once you set them all, enable, and then I would log out and log back in to ensure that those changes have taken effect. Then when I go to measure definitions, so within this window, right, so you have the column for denominator and numerator. So denominator is what makes this alert trigger for a patient. Remember, age, sex, diagnosis, right? So smoking, this one says number of unique patients at least 18 years or older, right? Well, in the numerator is what you need to do to satisfy that particular alert, right? So it wants you to capture the smoking status in the last 12 months, okay? So again, we're going to go into some of these. I'm going to do smoking. I'm going to do the mammogram, pneumococcal. And so if I scroll down, and here's my breast cancer. So see, it's females over 40, right? And then it wants you to do a screening. If I scroll down into my pneumococcal, right, it's number of unique patients over the age of 65, right? So it wants you to give the pneumococcal vaccination, right? Or say it was given in the past. Now, I can also, in this window, over on the right, associated order sets, you can associate order sets. You simply can click on the details and scroll down to which order set you want to link. You can also add reference documents. If you click on the pencil, so the pencil will let you edit what displays for your alert, but down here at the bottom is where you can choose a PDF that you also want to associate with this particular CDSS alert. So once you do that and you know that particular information, I'm going to go into my test patient, Sue Test. Now, Sue Test, she's 66 years old. She's retired, right? And so if I go to CDSS from my quick link, it's under the patient dashboard, CDSS alerts, I'm going to click on it. Okay, now purposely, I have not done anything for this patient just to show you how you can document the very simple things that you do normally anyway, and how some of those things can satisfy these particular alerts. Okay, within this window, it'll tell you the frequency of when it's due, the due date, right? It'll tell you if the arrow means it's a quick order set, meaning it has one thing associated, right? And the OS means that it's an order set, meaning that it will allow you to choose from multiple things within that particular order set. We have the status, which is all red, which means they're not compliant. When this turns green, it means they are compliant. You have the hand, which allows you to suppress, and the H is to add historical data. All right, so let's get started. So I'm going to close out of here. We notice we have smoking status, we have the depression screening, you have your BMI. So notice those things that show up. So I'm going to start with social history. And for all purposes, my patient, she's going to be, I made it as a non-smoker, but she's going to be a current smoker. And she's going to smoke every day, 6 or 10. I'm just going to quickly go through and mark some things for this patient. She's thinking about quitting, but she's really not ready yet. Since the upgrade, I've received this message, so I'm going to do a little force it to, so it says current smoker. Okay, perfect. I just wanted to make sure it pulls. So then I'm also going to go to alcohol. Now, both of these screenings are smart forms. So now she's retired, remember? So, you know, she's smoking and she's drinking. So she drinks often. and, you know, 1 or 2 drinks. She's enjoying life, right? And I want to show you how once you start adding these items in here, do you see how the points calculate over on the right? And then down at the bottom, do you see where it says in men, a score of 4 or more considered positive. In women, it's a score of 3 or more. So, which means that from an alcohol screening is that maybe we need to talk to her about, you know, she smokes too much, she drinks too much. She might want to consider, you know, slacking off a little bit or quitting altogether. So those are 2 very simple things, right? So now if I go back up to my CDSS, just to reference back, you see alcohol screening, smoking status, it's in green now, okay? So now I'm gonna go and I'm just going to, and these are things that you do automatically seeing your patients. So now I'm gonna go to vitals and I'm just gonna order some few of them. So it automatically calculated, I have my height, I have my weight, my BMI, can do heart rate, things like that. But once I do this and I take my vitals taken, this should also do my BMI as well. So if I reference back and I scroll down, you can see it has my BMI, okay? So now I'm going to go into preventive medicine to show you how you can, right, get credit for counseling these. So if I go to preventive medicine and I go to counseling, which is right here on top, and I go to smoking. If I click on smoking, what it wants the date that I counseled them to quit. And once you do that, it satisfies that measure. I can also take care of my alcohol as well from here. And it says moderation of alcohol consumption. And I can say alcoholism, whatever counseled about alcohol consumption. And if I X out of here and I go back to my CDSS, then I also can see that my smoking cessation intervention is now, right, it's green, I'm compliant, okay? So if I also from here, I want to resolve this pneumococcal. My patient, right, and is over 65 years old. And so if I go ahead and I give the immunization, and again, for lack of time, I'm not going to do everything. I'm just going to say it was administered. I'm not going to link it to a lot number or anything like that. But once I do give it and it says it's administered, right? Not partially administered. Once it's administered, then it will also, it resolves that one. So see now, it shows up in my list. Last done populates, and in the due date, it'll tell you when it's due again based on the measure, right? So this patient, it's not due again until 2026. Okay. So if I go over now, right, this is CDSS from here, but I also have the ability to use CDSS from my right chart panel as well. So if I click on CDSS, right, and now even from here, I can see, okay, a depression screening, right? They're due for it. So if I click on it, I can simply click the arrow and use my smart form, let it update. Not sure why it's pulling that. Let's try it again. Okay, it worked earlier, apologize. But watch this. I have another means of doing a depression screening. If I go to my smart forms, which is right here, I can also access my depression screening. And if I just say not at all, and I click save, again, you're going to choose other things. I'm going to force it to refresh as well. then you can see my depression screening shows up here, okay? So these are some simple things, and now my depression screening, right, is now in a compliant status, okay? So we still have a LDL, my breast cancer screening as well. So I'm gonna use, again, I'm gonna attempt to use my CDS from my right chart panel to resolve those. So if I go to my breast cancer screening, so here it's using a OS, which is an order set. So if I click on it, right, and this is a community order set that I'm using, I'm going to click on this mammogram. I'm going to click order selected and click close. And if I scroll down, you can see my mammogram screening has been ordered. I can also, from here, my LDL testing, if I click my lipid panel, because that's part of what's going to satisfy that particular, right, alert, CDSS alert, I can simply click on it. And now I have ordered my lipid panel and I've ordered my mammogram screening. So let's go back. I realize these are ICD-9s. They should be ICD-10s. But if I click back on CDSS, right, you see my breast cancer screening and my LDL, they're not green, right? They're not green because they haven't been resulted yet. So if I were to come back in and let's just say for my mammogram screening, it's taken it a little bit, and I click on the results, and I'm going to go to my lipid panel. And just for all testing purposes, I'm going to mark it as normal. And these numbers, don't pay attention to them. I'm making them up as I go, so I apologize. Right? And if I come here and I click OK, I put in my values and I go back to CDSS. Now, do you see I have, here's my LDL. It's now in green because I resulted it. I put in those values. I said it was normal. And so now do you see my data's changed for when it's due again? Okay. So if I go, I've given my pneumococcal, I've ordered a mammogram screening, I've done a lipid, right? I've did my vitals, and these are things, vitals, alcohol screening, those are things that you would normally do anyway. I did my depression screening, right? And then I've also come down here and used preventive medicine to say that I counseled them. So you may also find when you're doing CDSS alerts, right, that maybe for whatever reason, it didn't give you credit. So why could that be? Well, it could be because something's not mapped. Okay, so I'm going to show you where you can map things under community mappings. So if you go to menu and you go to community, right, I want to go to mappings. I'm going to show you smart forms first. So smart forms, and just remember, the left-hand side is the community mapping, call it the ECW hub. And the right-hand side is the local, which is your database. So if I click on social history, I know that it's blue means it's mapped, black means it's not mapped. So if I did this for alcohol, and I also did this here, do you see it's in blue? So it's mapped. If I go back in and now I want to check my labs. So if I go to labs, what's nice is once you're in here, you can double check labs and DI and structured data as well. So I like to mark this enable synchronized lookup. So if I do this for my labs, so let's just say hemoglobin. So here my hemoglobin A1C, remember this is a community side, the right-hand side is your database. If it's in black, you just have to map this community side with what you're doing on your local side in your database, and then simply click map, and that'll take care of that. If I go to for diagnostic imaging, remember my mammogram. So if I put in enable synchronized and I do mammogram, then you can see it's mapped. You can map one or multiple, as you can see, depending upon what you order in your particular practice. So if I click close out of here, you also, one more thing, if I go back to CDSS, okay, so let's say that your patient doesn't want to have this colorectal screening, right? For whatever reason, they want to suppress it. Maybe they don't want it. You have the ability, right, to come in and click on this blue hand, and you have the ability to suppress, say, for a year if you wanted. You have never remind, which means it'll never pop up for them again. Once you say 1 year, you can say, patient declined for whatever purpose, right? And you can click OK. Once you click OK and you suppress it, it shows up, do you see, at the bottom of your list, okay? Now, can I change this, right? What's the glory of being able to suppress an alert? You can simply click back on it. Oops, sorry, back on my hand, I'm clicking the wrong thing. I can reset this. So I can take this off if I want and put it back to its normal settings. So as you can see, I can suppress for a particular amount of time, or I can suppress it forever. But you also have the ability that you can reset it as well. This H is for historical data. So if I wanted to enter something as historical data, right, for this colorectal, maybe I want to document that they had it, 2 years ago or something like that, right? I can do that. Whoops, where did it go? Hang on just a second. Sorry. Can everybody still hear me?
Yes, try Control R on your screen, Therese. It
Yep.
looks like it
Okay.
froze up.
Okay. Thank you.
Mm-hmm.
Control R is a nice helpful little hint, and if you're using browser to refresh your screen. So if I go back to CDSS and I'm going back to my H, I have the ability to say when it was last done. I can use my calendar. And I can say that the result, was normal, and I can also record my lab values. So if I hit this, whether it's a lab, an x-ray or whatever, and I hit this, it's going to actually open up that particular order. I'm going to give it a little bit of time. It struggled with it last night, but I have the ability to put in, the collection date if I wanted to. Whoops, have to change my year. I also have the ability that I can come in and put in my the receive date. Change that as well. I don't know if I was consistent with all of that, but once I put it in, I can put in the results, then it'll put in that historical data. It should resolve that measure for me now. And it did. Do you see? So it's not due again now until 2029 based on the measure. Now, something else before I end and I transfer it over to Tiffany is when you're in CDSS and you're using the right chart panel, what I like about this that's really nice is that you can simply click on the I, and the I will give you the measure information too, so you know what it takes, what's going to trigger it and what you need to do to satisfy it. So these are some helpful hints. I hope that was helpful for you. These are things that we can help set up, or for CDSS alerts, there's some really neat videos out on the ECW portal as well. They're short little things, little videos that can help you with these things as well. But again, we can also help set them up as well. And now, Tiffany, I'm going to transfer it over to you to talk about questionnaires.
Great. Thanks, Therese. All right. Get my screen up here. Okay, can you guys see my screen?
Sure can.
Awesome, thank you. All right, so I'm going to start with questionnaires. So as Marie had mentioned a moment ago that sometimes they may feel more comfortable doing it online, fill out some of the like screening questions, alcohol screening, they may give you more information. It also allows you to free up some of your staff time where they're sitting and collecting that information, or maybe you're sitting the patient down with the paperwork, then the patient's like filling it out, and then after they're done filling it out, your staff are then having to enter all that information, or you're having to enter that information into the chart. And then you're scanning in those documents or whatever. So if you want to go with a more paperless style, they have an option that's called questionnaires within ECW. These can be used with a kiosk. So if you have an iPad and you have the kiosk set up, you can actually run your questionnaires through the kiosk based on the visit type. And then the patient can fill it out at the, when they go to check in. If you want to help guide them, filling out their information, maybe they need a little bit more guidance, the kiosk is a good option for that because you can be right there with them, helping them fill it out. The other platform that you can use is the patient portal. So based on that visit type, you can have a general patient portal questionnaire, or you can have a visit type specific questionnaire that can be linked to the patient portal, and the patient can go out there prior to the visit and fill it out on the patient portal. And then the third option is through Helo check-in. So all of them are Helo options, but the Helo check-in is another option that it sends them a text message. They go click on that text message that sends them a link to go through their check-in process, which includes questionnaires if you want to enable the questionnaires in the Helo check-in as well. So I'm going to show you questionnaires, and it's a little different in the older platform than it is in the newer platform. It does seem easier to build them in the browser platform. So you're going to start up at menu, you're going to go to EMR, and then you're going to go to questionnaire designer. And when you're on Questionnaire Designer, we have just a lot of random different questionnaires that we've created in our system, but you can see there's a lot of different ones here. I do want to mention that it says draft on some of these and it says completed on some of these. So draft means that these are still modifiable questionnaires, that you can still edit these questionnaires. They have not been completed by a patient yet, but once they've been completed by a patient, they are kind of locked in. That questionnaire can no longer be modified. So just be mindful that when you're working these questionnaires that you have it the way you want it before you publish it, and then patients start filling out the questionnaires, because it does become locked and you will not be able to edit that specific questionnaire again. But there is a tip to be able to edit a questionnaire that is marked as completed if you make a copy of that questionnaire, and basically it's a new questionnaire, and then update that, and then go ahead and disable the questionnaire that was previously used, relabel it or something like that. But let's look at questionnaires and how to create them. So we're going to go up here to the top where it says create new. You can name it whatever you want. And then these are based on structured data elements that are built into your progress note. So for instance, your smart forms, they're built in, a lot of them are built into social history, some are built in the HPI section. So for instance, the social history, if you're wanting to do the smoking screening, you can just go to social history, tobacco use, and then you can just click on the questionnaire and then add it to your questions. Go back, add the next one, add all of those, then select add. And now you've added all of those questions. And then again, just continue, go to social history, go to drugs and alcohol, go to alcohol screen, add those. These are already pre-built in your system as smart forms, so they're just there for you to start adding them as questionnaires if you so choose to do so. You can do opioid risk tool as well. So again, the patient is filling out all of this stuff digitally. You don't have any paper trail. You don't have somebody sitting there asking the questions. They just digitally fill out all the information, and then you can actually push it into the chart. So I think there's some in HPI. I think the depression screening, those are smart, all these are smart forms, but you kind of get the gist that you can basically go in here and add in your different questions that are included in your wellness visit. So, whatever those options are. So you can collect a lot of information from a digital format. So to prep the chart prior to the patient's visit, once I have that prepped, I'm going to hit save. I can select preview, and then it shows me what the patient's going to see. So the patient sees, are you a tobacco user? And then they can go in and answer all these questions instead of you having to answer those questions through the system or having them manually fill out something on paper. You can have them do it digital. Okay, so I'm going to go ahead and publish this. So now it is a questionnaire that can be utilized. It still says draft because even though I've published it, there's been no patient that has filled out that questionnaire. Once I link it to a visit to a kiosk or Hilo check-in or to patient portal, then it becomes, and then a patient fills it out. The first time they fill it out, it becomes completed and no longer can be modified. But again, you can make a copy of it and then update the new one and just disable the one you were using before. Don't use it. Relink it in your kiosk or your Hilo check-in options. You can relink the questionnaires to the right visit type. So looking at this, I did put somebody on the schedule. And I did it through kiosk just to throw it in there. We do have something broken on our system, so it may not push it into the note, but I wanted to show you how this would appear digitally. So I filled out the questionnaire through kiosk. And then when I filled it out, if you notice up here in the right corner of your progress note, you have a blue sticky called Hilo. So whether it's Hilo check-in, it's patient portal, or it is kiosk, you can then collect this information through your Hilo sticky note. So you have the download button, and you also have a indicator that there's information available, and of course it says patient entered data. So since I did this over the kiosk platform, I can just click on that little drop down arrow. And as you can see, anything that was answered on the kiosk is going to appear. So we had surgical and history allergies was enabled in our kiosk, but here's the questionnaire. So the patient fills all this information out. You can import current page or you can mark it reviewed. If you import current page, which has been broken in our system, so it may not do this, but I have seen it in our system work correctly. I think since the update, it's kind of messed up some things. But if you select import current page, it's supposed to display the questionnaires into your progress note, into those sections. So it doesn't look like it's going to in our system, but I do know it works. But it's going to populate the social history, those items that Therese was showing, like the tobacco screening, the alcohol screening. It'll display in your note. And I do want to mention this is patient collected data that's not filled in by your staff or yourself. So you might want to consider putting on a notation so that when you're looking at that data, you know that was patient provided directly from the patient portal. There is some way here that you can signify that that information was collected via the patient portal, kiosk, or Hilo check-in. If you go to settings and then practice defaults and then portal, you have this append data imported from portal with. So you can put whatever you want here. But what it's going to do is every statement that was made by that patient is going to have that insignia next to it. It's just a visual indicator that you have collected that information was collected directly from the patient. So if you ever need to go back and verify that information, review it, you absolutely can. And again, that information will populate in the note. You can make your use a preventive medicine section to document your counseling and such as you would like there as well. I know we're running short on time, but a couple of things I did want to mention is with your, for instance, your labs on the community mapping, just be mindful. I know there's different lab companies. You have to map all those labs. So if you have a hemoglobin from like 3 different lab companies, I would recommend that you go in and map all 3 hemoglobins so that if any of those hemoglobins are ordered, then it's going to satisfy that alert. The other thing I want to mention is those alerts are also set into your registry. So if you ever need to see, like before the patient comes in, what they're due for, is patient recall. You can go in and see what protocols the patient is due for. So if you wanted to look for who all is due for mammograms, maybe that month before, you could actually look and see who all is due for the mammograms and prep. Just send them letters or something like that to let them know that they're due for those CDSS alerts. And that's all I have. Sydney, go ahead and you can take on over.
Yeah, thank you so much. Thanks again, Marie, Therese, and Tiffany. That was a lot of great information to take in. So if you missed anything, don't worry. Again, I will send you an email later today with the slides and the recording of the webinar. So now that we've reached the end of the webinar, we do have a couple more minutes before the hour, so we can go ahead and take a couple questions. If you have any, type them into your chat panel and we will get to those. As we wait for those questions to come in, I want to make sure you know how to get in touch with us if you'd like to learn more about any of our services here at Revell. Following the webinar, you will get a quick survey. You can let us know how we did or request for one of us to get back in touch with you. You can also simply reply to one of my follow-up emails and our team will be quick to get in touch to see how we can help. We can also get a discovery call with your practice and one of our representatives scheduled. That will help us talk through pricing and next steps for your clinic. If you are interested but aren't quite sure if it's a good fit, I'd still encourage you to get in contact with us so we can put together some detailed info based on eligibility and specific goals. So this was the third and final webinar in this annual wellness visit series. So thank you so much for tuning in to join us for this incredible series. In my email following the webinar with the slides and recording, I will be sure to include copies of the previous two parts of the series so that you can have everything at once. So we do have a couple questions in the last few minutes here. So first, are annual wellness visits a telehealth service?
Did we lose Marie?
Let me see here. Looks like she's
Hi.
still here.
I'm sorry. I already answered the question. I was muted. I'm sorry. Okay, so with that.
Yes, it's not me. Thank you.
Okay, so sorry about that. But as I referred earlier in today's presentation, that I had made an incorrect statement in our previous parts of our webinar. And yes, the answer is yes, that the annual wellness is a telehealth service. So my apologies once again.
Oh, no problem. Okay, I see. Can you bill preventive services with annual wellness visits?
Tiffany, I know the answer to that one too. Yes. An example would be if it is discovered during the annual wellness visit that the patient's sister has just been diagnosed with such as breast cancer and the patient is asymptomatic. Okay, so that is key word right there. Patient has to be asymptomatic. The provider would want to perform a screening mammography.
Great. Okay. And let me see here. What else do I see? How can I document a flu shot if given in the past?
Hi, that's me, Sydney. So if everybody can see my screen, there's a couple of different ways to do it. But if I click under my quick links under the patient dashboard, I would go to immunization. And I'm going to click on add, and I'm going to pick my appropriate flu shot, which I'm going to pick flu zone, right? And I'm going to mark this option right here, vaccination given in the past. And then I'm going to say whenever that date was given, maybe it was given back in, January or whatever the case may be, right? I can document that, and it says the documenting facility. And once I do that and I say that it was given in the past, then it's going to take it off my list. You can do this from the quick link up here, or you can do it down from, immunizations as well. If you were to go here, it's the same thing. You're going to click on whichever one you want. The difference is if you do it from the progress note area and you say given in the past, the problem is it won't display in your note like pneumococcal because you've given it in the past. I'm going to take it off of here. But it was given in the past. So what it does is if you give it in your progress note, it flips it up to their immunization history. But I chose to do it from the immunization history, which is equally acceptable as well. And if I go back to my CDSS, it is now taken care of. To scroll down, yep, here's my flu, and it's not due again until 2021, well, later on this year. So okay,
Great. Yeah, thank you.
thank
So
you.
looks like we hit the top of the hour, and we are out of time for this presentation. So I'm going to go ahead and wrap up today's webinar. But for any questions that came in that we did not get to, I will make sure to reach out to you later today to get those questions answered. Thanks again for joining us, and have a great rest of your day.
Thank you, Sid. Thanks.